Hello, everyone, and welcome to another episode of the Overcoming Chronic Illness podcast. My name is Dr. Brian Raid, and I'm a naturopathic doctor. And today I am going to talk to you about the Neural Zoomer Plus. You can see in the background here of my screen, if you're watching this on YouTube or YouTube's the only video platform I use. If you're watching this on YouTube, you can see that I have a report up in the background here, and I'm excited to talk about this report because it's something we've been using at our clinic for a little while now. Been running it on lots and lots of patients, and it's something that I found to be really, really useful. Um, So, as per usual, nothing that I'm saying during any of these podcast interviews or episodes should be construed as medical advice. This is all for informational purposes only. And if you need healthcare advice, please talk to your healthcare provider to get that advice. This test is offered by a lab based out of the U.S. Called Vibrant Wellness, and Vibrant Wellness offers a whole range of different testing assays. So I'm going to talk about the NeuroZoomer Plus today. If there's interest, there's some other profiles that we run of theirs that I'm happy to talk about as well. There's one all about autoimmunity. There's one that gets into specific ways that folks react to foods. So it's different than standard IgG for food sensitivity testing. And so I might do a video on that, or post a podcast episode about that at some point. So we'll see how much interest there is in this topic and kind of base it on that. With the Neural Zoomer Plus, there's a few cases that I want to go over because I'll talk about what the test involves, talk about the different things that it tests for, but then I have a few sample reports here from some patients that I've like real life patients. Obviously, the big black box in the upper left corner there. I've blocked out their names, obviously, for confidentiality purposes, but I'll go through a few sample reports and give you a bit of a sense of the clinical flavor of what this actually looks like in clinical practice, and we'll just see where the conversation goes. Um, so the NeuroZoomer Plus, it tests for 47 different markers that relate to nervous system function. The majority of those markers relate to central nervous system parameters, so central nervous system being the brain and spinal cord. There are some markers that look at peripheral nervous system health as well. So peripheral nerves being our spinal nerves, basically all the nerves that are outside of our central nervous system. And then there's also a section, as we'll see here coming up, that looks at antibody levels against different viruses and also streptococcus. So a bunch of viruses plus strep being the special bacteria that gets special mention here in the report. And the reason that we care about strep and these in these particular viruses is that they are implicated, or they can be implicated, in different neurodegenerative conditions or neuroinflammatory conditions, such as Alzheimer's, such as multiple sclerosis, such as PANS or PANDAS, which are pediatric specific conditions. Have some other podcast episodes and other videos on social media talking about PANS and PANDAS. If you're not familiar with that, please cross-reference that if you're so inclined. And so it measures a whole whack of different markers related to nervous system function. So as we can see here on the screen, I'm really hoping that my little picture of me is not blocking anything crucial here. So hopefully that's good. So I'll move things around a little bit, and if it's blocking, hopefully things will be unblocked if needed. Also, if you want to cross-reference one of these reports, you can just go to the Vibrant Wellness website, and they have sample reports of all the different tests that they do. Now, I do want to clarify that I have no financial interest or financial relationship with Vibrant Wellness. This is just a lab that we use for our patients. When our patients do testing through us, they pay the lab directly. We make no money whatsoever if they do the testing through our clinic or not, and I'm not financially involved. So I just want to clarify I have no conflicts of interest with talking about the Vibrant Wellness report. It's just a test that I found to be useful and wanted to share it with my audience. All of the parameters that are tested or all the markers, I should say, that are tested within a NeuroZoomer Plus are antibodies. So if we take a look here, and oh my gosh, yeah, I don't usually use a cursor here, so I'm not gonna point with my little pointer because I'm not sure if it's actually going to come up or not. So I'll just verbally describe what I'm referring to here. So if we look at the left-hand column, there's the list of the various antigens that are, in this case, demyelination antigens that are being tested. Then the next column over at the top there, it says IgG plus IgA. So that refers to these different antibody types. So we have, IgG antibodies, IgA antibodies, IgM antibodies, IgE antibodies, and IgD antibodies. And so this is looking at the sum total of IgG and IgA antibodies. The significance of that is that IgG and IgA antibodies are the antibodies that we have that are kind of like the memory antibody response, the longer standing, longer lasting antibodies. So the analogy that I use is that if, say, someone has um, say someone lit a fire and there's a fire burning as a consequence of lighting that fire. The IgG and Ig antibodies are essentially telling us that someone lit a fire at some point in the past, but there's not necessarily someone currently lighting more fires. So the fire's been lit and it's burning away. The next column over, which is the IgM antibodies. So IgM antibodies are generally the first line of immune system response that we have to an infection or if there's an autoimmune process going on. So the IgM antibodies are really more indicative of whether there's some active fire lighting happening right now. So if there was, say there was a forest fire and we just hear that like, well, there's a forest fire. Well, and that's all the information that you have. It's like the question is like, well, did somebody light that fire, days ago and it's been, burning ever since? Or is there someone that's actually that say lit the fire days ago and they're actually still going around lighting more sites of the forest on fire? So that would be the IgM antibody levels would be reflective of that. So again, generally speaking, IgM is the first type of antibody that occurs when there's an infection or an autoimmune process happening. The IgG and IgA are kind of like the perpetuating antibodies that kind of keep the ball rolling with that inflammation, with that immune system response that's going on. So I'll get into the weeds or the specifics of why that matters or why it's good to have that differentiation moving forward with some of the specifics of some of these reports we're going to look at. But that's the backdrop. Now, if we move further over to the right, you can see there it says previous IgG plus IgA and previous IgM. So there's nothing there because this is the first test that this patient had. So down the road, the plan is for this patient to do the test again, after a few months, maybe 3 to 6 months of treatment. Then we're going to look and see how those levels are looking, and hopefully we're going to see improvement. That's the plan. And of course, if there's not adequate treatment, or maybe if the patient chooses to not undergo treatment, or if some other factors conspire, of course, certain things could look worse over time. So one could use a Neurozoomer Plus to as another metric to track how an autoimmune process is progressing, say something like multiple sclerosis, or how a neurodegenerative condition like Alzheimer's or Parkinson's is progressing. So, of course, we generally want those conditions to improve or at the very least stabilize. But of course, those are neurodegenerative conditions, so they can get worse over time. So when we're comparing the previous results to the most current results, then we're getting a sense of things getting better, getting worse, staying about the same. And the immune system, at least the memory aspect of the immune system, that IgG, IgA, that generally tends to move pretty slowly. So we, wouldn't really, generally speaking, wouldn't really expect to see a dramatic change in the levels of these antibodies in a short window of time. That's why we would generally want to wait, in my opinion, at least in my experience, like at least a few months before we'd want to retest antibody levels against X, Y, or Z agent or substance. So let me see. I think that's so the last thing I'll mention here before getting into some of the specifics here of this particular test result is that so at the end of a Neurozoomer Plus report, there's a list of all the antigens that are tested for. So as we're seeing here, the antitubulin, anti-myelin basic protein, anti-myelin oligodendrocyte glycoprotein, et cetera, et cetera. And so this is going to tell us about all the levels that are the results for all the different antigens that were tested, whether they came back looking normal or they came back looking abnormal. The earlier, further up on the report, if you kind of look over to the right side there, you can see the slider bar on this PDF file is, say a little over halfway down the document. So further up, we can see that they actually summarize all the abnormal findings. So with this report, we'll just go through the the full list of antigens, so to give you folks a better sense of what the report actually looks at. Then for the next couple, we'll just look at the summaries to see, what actually came up. So they kind of categorize it or organize it a bit, which is handy and lets us go over things a little bit faster. It's nice to see this section though. I think because